Welcome to an introduction to cognitive behavioral therapy. My name is Ken Wright, and today we're going to be talking about cognitive behavioral therapy, what it is, and how we can use it to make some positive changes in our life. So, we're going to start with a very basic idea, fundamental idea in cognitive behavioral therapy called the CBT triangle. And here is the CBT triangle. Here we see thoughts, behaviors, and feelings. And what the triangle means is that each of these things, thoughts, behaviors, and feelings, are all connected. And so if we want to change the way that we feel, a lot of people come to therapy, they want to feel better, they want to be happier, they want to be less depressed, less angry, less frustrated, less anxious. What this model suggests we need to do is, in order to feel differently, we need to change the way that we think or change the things that we do. So here's an example. Say you go to a cognitive behavioral therapy class. This would be an example of a behavior. And if you go to a class, you might have the thought, if I say something stupid, then everybody will judge me, and that would be awful. This is an example of self-talk. And when we have a thought like this, it's normal that we would be feeling anxious. We'd have anxiety because of this thought. We're worried that we're going to get judged, and that would be awful. This anxiety then could motivate us to behave in particular ways. And when people are anxious, one of the most common behavioral responses is avoidance. So in this example, we feel anxious about talking in class, so that might motivate us to avoid talking in class. That way we don't get judged. Unfortunately, as this pattern repeats, we never learn that we can talk in class without being judged, and we don't learn that even if we are judged, it's not going to be awful, or it doesn't have to be awful. So here's some basic information about cognitive behavioral therapy. CBT tends to focus on our current patterns of thinking and behaving. We realize people have gone through really challenging experiences throughout their life, but instead of trying to change the past, we are focused on what is occurring in the present. It's our thinking, it's our remembering the past and the present that is creating our current suffering. CBT aims to provide people with the tools that allow them to deal with their problems independently, training people to be their own therapists. And it strongly encourages people to practice skills inside and outside of sessions or groups. So an example here is if you have a goal of getting really fit and you go to the gym one time, you're going to make very minimal progress towards that goal. However, if you continue to work at it, you're going to make more progress quicker. And this is sort of how CBT works, or therapy in general works, is when you apply the tools and you practice them in session and outside of session, we tend to make progress faster. So this is just an introduction, but here are two books that can provide more information about cognitive behavioral therapy if you're interested. The book on the right is probably one of the most recommended self-help books of all time. Dr. David Burns' Feeling Good Handbook. And on the left we have Mind Over Mood, which is a really great workbook filled with a variety of activities and worksheets that people can use to overcome their problems. And self-help, there's a lot of research behind the validity of self-help and helping people make positive changes. So I want to start with a review, a meta-analysis. So this is a review of several different meta-analyses. They looked at 16 different methodologically rigorous meta-analyses back in 2006. And what the authors of this review of meta-analysis concluded was that CBT had a large effect on depression, generalized anxiety, panic disorder, social phobia, post-traumatic stress disorder, and a moderate effect size on marital distress, anger, and chronic pain. Now, I'm a bit of a skeptical person. I tend to prefer having a fair amount of evidence before really believing something. Maybe that's why CBT fits for me. So let's review another review of meta-analysis. In this study, in 2012 review, they looked at 106 meta-analyses. And they concluded that in general, the evidence base of CBT is very strong, especially for treating anxiety disorders. It is clear that the evidence base of CBT is enormous. You're welcome to check out each of these reviews on. Now, before we talk about using cognitive behavioral therapy to make positive changes in our life, we have to talk about something called resistance. People tend to resist making positive changes in their life for a number of reasons, both psychological and practical. I'm sure everybody has had an experience where you have a loved one that's in a terrible relationship and you'd like them to leave their partner, but for whatever reason that person resists making that change. Or you've been in a very challenging job that you don't enjoy, and for whatever reason we are ambivalent about making a positive change. We resist making that positive change, even though we might have a lot of reasons for why it might be a good idea. So we need to talk about resistance. So let's start by thinking about what kind of behaviors keep problems going, keep us stuck in problems. So for example, if we're depressed, some things a depressed person might do that might keep them depressed is isolating themselves, avoiding things, excessively resting, not engaging with behaviors or activities that they previously enjoyed. All of these things can keep us depressed, even though it's sort of the paradox of depression is that the things that would make us feel better are the things that we're probably least likely to do. Let's take worrying, for example. So anxiety is a problem that a lot of people struggle with, and worrying is a behavior that can perpetuate that problem. So if we want to feel less anxiety, we need to worry less. So let's break down what are some of the positive benefits that we think we're getting from worrying, or our mind thinks it's getting from worrying, and what are some costs. So some people might say there are no benefits to worrying, that worrying is all bad, and they're really motivated to make some positive changes and not worry less. But if worry was all bad and there were no perceived benefits to worrying, we wouldn't do it. So we need to really challenge ourselves to think about what are some of the positive perceived benefits that we get from worrying. So when you ask somebody with anxiety why they worry so much, they might explain one reason as my anxiety or my worrying keeps me safe. And this is worrying is trying to anticipate what could possibly go wrong in the future, and maybe even thinking about what I would do if something bad happened. So I would worry about if I go camping, I might worry about it raining, therefore I would take a tarp, and therefore I would avoid having to deal with the problem of being soaking wet while I'm trying to camp. So in this way, and the ability to anticipate problems keeps me safe. Another justification or explanation for why people worry is that sometimes people think my worrying shows that I care. If I don't worry about something, then it would almost be flippant, or it would show that I don't really care about that thing. Another one is the sort of emotional desensitization idea, which means that sort of if I worry about a bad thing happening and that bad thing happens, I won't feel as bad. So if I worry about my partner leaving and they leave me, I won't feel bad when they leave. Another positive perceived benefit of worrying is something called magical thinking, and this is the idea that if I just worry enough about something, then the universe will listen to that and prevent that bad thing from happening. Also, maybe a positive side of your personality, maybe your worrying shows that you're a cautious person that doesn't engage in reckless behaviors. So these are some of the perceived benefits of worrying. Know that we have probably some problems with this list that we can get into later, but for right now, you might think your worrying benefits you in these ways. So some costs of worrying is worrying makes you anxious. If you have the ability to anticipate problems and just imagine all the terrible things that could happen, and not feel anxious, there's probably a pretty big disconnect there. So a lot of people want to get rid of the anxiety. They want to feel better inside of their body, but they want to keep worrying. And unfortunately, we're just not wired this way. We know that worrying and anxiety can lead to health problems. Anxiety interferes with our ability to sleep. Anxiety can lead to excessive avoidance. For instance, when people are anxious about social situations and they avoid social situations, well, what happens to your life satisfaction when you have to avoid everything that involves people? You're removing all of those beautiful and fun and interesting things that could have happened in your life just so we don't feel anxious. Another is anxiety interferes with our relationships and or our work. It prevents us from accomplishing our goals because people don't tend to love being around anxious people. And so we can inadvertently push the people we love away when we're really anxious. So maybe you're looking at this list and maybe you've got some more benefits or some more costs that I haven't put up here on this slide. You have to decide for yourself. If you're trying to work on your worrying or your anxiety, you have to decide for yourself which of these two sides is more important to you. And you know what? If the benefits right now, the benefits outweigh the costs, that's totally understandable. You're still welcome to listen to this lecture and learn about cognitive behavioral therapy, and maybe in 5 years or 10 years or whenever, maybe your anxiety gets so bad, then you realize that the costs outweigh the benefits and you're motivated to make a positive change in your life. And luckily, you have learned all of this interesting cognitive behavioral therapy stuff, and you can apply the ideas at that point in your life. Alternatively, if you've decided that the costs outweigh the benefits and you're now ready to get rid of your worry, you're ready to forego those perceived benefits and try and worry less, the stuff we're going to talk about in this course is going to be really helpful. So if you're struggling with anxiety, hopefully this was a helpful activity. If you're struggling with depression, I encourage you to practice this on your own. Get a piece of paper and think about, what am I doing that's feeding my depression? Like, am I isolating? Am I overindulging in substances to feel better, or eating, or am I self-harming? What am I doing that's feeding into my depression? And look at the actual real benefits and the costs of those behaviors and weigh it out for yourself and see if that's actually something that you want to make some positive changes on. Another problem is we frequently want to get the most benefit with the smallest amount of effort, and this tends to keep us stuck. As human beings, we are maybe programmed to try and find the quickest fix. We want a pill, or we want a magic button that can just take away our problems and make everything better. We want the biggest amount of bang for the smallest amount of effort. And unfortunately, this can keep us stuck. So with cognitive behavioral therapy, I encourage you to maybe do slightly too much work as opposed to not enough. Don't get obsessive about it. Don't be practicing this stuff constantly. But if you're a person that like really struggles to make positive changes in your life, maybe it's because you're not doing enough of the work. So I encourage you to try, maybe push your comfort zone and really challenge yourself to make some positive effort. Okay, this brings us back to the triangle. We are going to start on the thoughts side of the triangle. It's really interesting stuff that we're going to get to today. So by the thoughts side of the triangle, I'm talking about assumptions, predictions, fantasies, memories, beliefs, interpretation, self-talk, both subconscious and unconscious material, and conscious material. Basically everything that happens in the mind is considered a cognition. That's where we get cognitive behavioral therapy. And so we're going to talk about these things, assumptions and predictions and memories, and how they influence our feelings and our behavior. So we're going to start with a little model here. Say there's a factual world that is outside of yourself, an objective reality. So basically, like, there are facts in the world. You're watching this video right now. That would be considered a fact, right? Or I'm saying things that you're listening to. We interpret the world through something called our core beliefs. this is a type of cognition that we're particularly interested in cognitive behavioral therapy. And core beliefs are like a lens that we see the world through. We interpret the world through our core beliefs. This is why you can have different people look at the exact same thing and have different opinions about it. It's because we're interpreting these things through different beliefs. Core beliefs, we interpret the world through our core beliefs, and then we have automatic thoughts. And automatic thoughts are a really important part of CBT, because automatic thoughts are thoughts that pop into your head automatically, and we tend to just accept them as true. We might not even realize that we're having automatic thoughts. And automatic thoughts have a very powerful influence on our feelings. So if none of this makes sense right now, that's totally fine. Don't worry about it. I'm going to try to explain in more detail over the next few slides. Hopefully it makes more sense. So let's say that this C-shaped circle thing is a core belief. Specifically, it's the core belief that you're a failure. Maybe you were told this as a child, or you had experiences that led you to believe this. You have this core belief, I am a failure. Now, say you go on about your life and you have this core belief, and for whatever reason you do well on a project, whether at school or work or something, but you do well on the project. In this situation, you could have an infinite number of automatic thoughts, and you could think anything in this situation. Here's an example of 3 things you could possibly think. You could think, it was luck, I am not a failure, I'm good at some things, less good at others. Okay. Now, the automatic thought that we are going to have is going to be consistent. It's going to fit with that core belief. So say we see I am not a failure did not fit with that core belief, nor does I'm good at some things and less good at other things. But it was luck fits with that core belief, and so that is going to be the automatic thought that we have. So how would you feel if you went throughout your life with this belief that you're a failure, and anytime you did something good, you just dismissed it as luck? Well, you'd probably feel pretty frustrated, maybe even depressed, right? And this is one reason we have core beliefs, is that they're resistant to change. We have what's called a confirmation bias. We dismiss evidence that doesn't fit with our core beliefs, and we tend to accept things that do fit with our core belief. So we dismiss the idea that you did good on our project, and we just accept that it was just lucky. Here's another example. Say you have this core belief that you are unlovable. For whatever reason, we tend to learn our core beliefs from experience. So actually we do learn our core beliefs from experience. So you have this core belief that you're unlovable. And in this situation, your partner is late for dinner. Okay. Now, how many possible explanations are there for why your partner is late for dinner? Well, there's probably an infinite number of things that could have happened that have resulted in your partner being late for dinner. A satellite could have literally fallen from the sky and crushed your partner's car, preventing them from being late for dinner. But here's 3 assumptions that we can make in this situation. We could assume they're mad, we could assume they're stuck in traffic, we could assume they had to stay late at work. But again, the automatic thought that we're going to believe is the one that fits with our existing core belief. And so we might think that they're mad at us because it fits with our belief that I am an unlovable person. So here we see a child stick person, and they're interacting with an adult stick person, and the adult says, you're a bad, selfish, unlovable, and a failure. Okay, and then they move on with their life. And our child stick person grows up into an adult stick person and has learned they're bad, selfish, unlovable, and a failure. Okay, so they have this core belief, or these core beliefs. So then when they do something good, they think not good enough, so it doesn't count, and that core belief does not change. They help someone else. You'd think this would contradict the idea that they're selfish. But again, they dismiss it. This thing that I did also helped me, so it doesn't count. They enter a relationship, which you think might contradict the idea that they're unlovable. Well, they can dismiss that. Well, they're eventually going to leave. They're going to learn that I'm unlovable and they'll leave. Therefore, this does not count. They succeeded something, which you'd think would contradict the idea that they're a failure, but again, they can dismiss it. Still more failures than successes, so it doesn't count. So the point of what I'm trying to suggest here is that we are going to try to look at all of life, not just the things that fit with our existing core beliefs, but instead we're going to try and challenge those core beliefs because these are oversimplified ideas about you or a person or a stick person. And instead we're going to try to make them more complicated, more nuanced, and in reality more accurate. So we're going to have a more accurate view of ourselves that not only maybe looks at the things that we could do to improve, but also the things that are pretty great about us, that are good about us, our values and our strengths. This is an interesting quote that I found from a book that I was enjoying. If you ignore evidence to the contrary, almost any belief can seem rational. They were talking about psychosis at the time, but I think it applies to every person. And this is really true, I think. If we ignore evidence that doesn't fit with our core belief, then our core beliefs can seem real rational. Alright, so automatic thoughts, let's move on to that. Here we got a stick person. Their mouth is aligned, therefore you know that they're feeling kind of neutral. That's how psychology works, I think. And our stick person thinks this has been a pretty good day so far. This would be an automatic thought. How do you think this stick person feels when they have this automatic thought? Right, they're feeling pretty good. Pretty good day so far, they feel alright. Then they have the automatic thought, I forgot my lunch, I am such an idiot, and they feel down on themselves. Why can't I do anything right? This is an example of an overgeneralization, and you can see that they're sad. I cannot afford to buy lunch again. This is maybe some anxiety here. Why does this always happen to me again? An overgeneralization, and they're feeling like a sad puppy, and nothing is sadder than sad puppy. So here you see the relationship between automatic thoughts and feelings. So I want to talk about this optical illusion. Okay, so we know that thoughts create your feelings. Your perspective creates your reality. So if this is true that our thoughts create our feelings, we need to think about our thoughts. We need to think about them critically. Here this is an optical illusion. The center line between each of the wings of the arrows for both the top and the bottom are actually the same distance. So the center line is the same distance in both of these two figures. Even knowing that, it still visually appears as if the bottom line is longer than the top. This is just a simple example where I'm trying to suggest that just because we think something is true does not mean that it actually is true. Just because we think the bottom line is longer than the top doesn't mean it is true. Just because we believe that we are a failure doesn't mean we are a failure. Just because we think people are untrustworthy does not mean they're untrustworthy. Just because we think the world is just filled with terrible danger all the time doesn't mean that it is. And in cognitive behavioral therapy, we're going to use tools and techniques to think critically about our thoughts so that we can find reality. So we can learn whether or not those lines are the same or different. So the point here is just because we think something does not mean it's true. And if you have any questions about that, I encourage you to check out some psychology experiments from the last 50 years because you might be shocked at how rarely people are actually correct in their thinking. All right, so I want to introduce another big idea in cognitive behavioral therapy, and I want to start by asking a question. And this is simply, what makes you angry? When I ask people this question, they tend to give me a list that looks something like this. Maybe bad drivers, being treated unfairly, not being listened to, being lied to, being criticized, doing something poorly. All of these things lead to anger, is what people tell me. And this is a belief that we hold in our society. We believe that something happens and then the somethings that happen create our feelings. So, for example, being criticized makes us angry. But if this was true, that being criticized creates anger, then everybody who gets criticized should feel angry. If that's all that it took was criticism equals anger, everybody should feel that way when they're angry. So, this brings us to a really important idea in cognitive behavioral therapy, and that is that our feelings are not externally caused. Other people in bad situations are not to blame for our suffering, our anger, our sadness, our guilt, our grief, etc. The situations that happen in our life, things that happen to us, do not create our feelings directly, but instead, it is something else. So, we are going to try to disprove that something happens equals feelings. And what I'm going to suggest instead is that something happens, then we have thoughts, and then we have feelings. It is our perspective, it is our beliefs about what happens to us that creates our feelings. And I realize, there are probably people at home right now thinking, this is absurd. This bad thing happened to me, and if this bad thing happened to anybody, they would feel the same as me, right? I got fired. That's a bad thing. If anybody got fired, they'd be angry and frustrated. But is that true? Is it true that every person that gets fired feels the exact same as you? So, this course is about skills. And the first skill that we're going to talk about is identifying unhelpful thoughts. And I'm going to talk about one specific tool that we're going to use to identify unhelpful thoughts, and that is the ABC model. So the ABC model is, it goes back several decades, but A stands for activating event. It previously was called antecedent. In cognitive behavioral therapy, our past has sort of a history of sometimes coming up with really fancy, complicated names for things. But don't worry about that. We're just going to call A activating event. And what the activating events activate are beliefs. And we use beliefs here because it starts with B, and we want it to be ABC, I imagine. But what we really mean is cognitions. Basically, everything that happens in our head, it starts thinking. So something bad happens to it, I think things, and then there are consequences. And those consequences are feelings and behavior. If we think about our triangle, we have everything covered here. We have beliefs, thinking, and behaviors in consequences. So the activating event is the what happened. Then the beliefs are assumptions, predictions, interpretations, images, fantasies, everything that happens in our head. And then that leads to emotions, behaviors, and sometimes in the ABC model we can also list some outcomes. So here's an example that hopefully helps illustrate the idea of how perspective and beliefs create feelings and behaviors. So say I had this activating event. My boss comes to me and goes, Ken, we've noticed that you've been using the photocopier wrong. So I get criticized at work. That's what my boss says. Now, there are multiple different ways I can interpret this situation. I could think something like, oh my god, I'm going to get fired. It's not fair. My coworker uses the photocopier that way all the time and you don't give them heck. you must just hate me and you're taking it out on me. And if I think these kind of thoughts, how do you think I'm going to feel? Well, I'm going to feel terrified. I'm going to be terrified of losing my job. I might be angry that I'm being singled out in this way. And these emotions might motivate me to behave defensively. I might say something like, "Why are you criticizing me when my coworker uses this way all the time? Like, why are you singling me out?" This defensiveness. Now, this brings me to the idea of a self-fulfilling prophecy in cognitive behavioral therapy. And this isn't like self-fulfilling prophecy in that I put out into the universe negativity and then it creates that negativity. It's a very practical kind of way of creating self-fulfilling prophecy. My thinking, worrying about getting fired in this example here, creates feelings like fear and anger, which influences my behavior. It it leads me to behave defensively, which actually increases the likelihood of me getting fired. So, in this practical way, my thinking influenced my feelings and my behavior, and it actually increased the likelihood of my fears coming true. Okay, exact same situation. The activating event doesn't change at all. The activating event is the least important part of the ABC model. But my boss comes to me and says, "Ken, we've noticed you've been using the photocopier wrong." It's the exact same as situation number one. But if my thinking changes, I go, you know what? Doing my job well is really important to me. I want to be a competent professional employee. And you know what? If I am using the photocopier wrong, then learning how to use it correctly actually makes me a better employee. This criticism actually helps me move closer to my goal of being a good employee. Furthermore, I think my boss would probably prefer an employee that demonstrates that they can receive feedback in a non-defensive way. Like if I just blew up every time my boss criticized me, she'd probably get tired of that pretty quick. So this is really an opportunity to show my boss that I can take direction. And so if this is my thought process, maybe my knee-jerk reaction when I get criticized is like, "Oh my god, she doesn't like me." But if I catch myself and I respond to the situation in a more rational kind of way, you know what, this actually makes me a better employee. This is an opportunity to show her that I can take feedback. How do you think I feel? Well, this different perspective leads me to feel maybe a little bit of anxiety. It's not the greatest feeling in the world getting criticized at work, but I'm more calm. I can show appreciation. Oh, okay. How I can say something like, "Oh, okay. How can I use the photocopier better? Thank you for bringing this up. I didn't realize I was using the photocopier wrong." And when I receive the feedback in this way, it probably increases the likelihood of keeping my job. My boss likely goes back to her office and goes, "You know what? That Ken, he can really take feedback really well." So in this situation, the bad thing that happened hasn't changed, but my thinking about the bad thing has changed, and as a result, I feel differently and I behave differently. So in order to use the ABC model, we need to know the difference between thinking and feelings. And English does not really give us a lot of help with this. For instance, we often confuse thoughts with feelings. We could say something like, "I really feel like it's your turn to do the dishes." Well, that's not a feeling at all. That's a belief. I believe that it's your turn to do the dishes. So here are some common mistakes people make. Rejected. Rejected is not a feeling. I don't feel rejected. I feel hurt because I believe that I am being rejected. It is a description of how someone else is behaving. I believe they are rejecting me. Here's another example. Betrayed. So again, similar to rejected, you're describing what someone else has done, and you probably feel maybe angry or hurt or sad about being betrayed. Those would be emotions. So the beliefs belong in the belief column in our ABC, and the feelings like hurt and angry belong in the C column in the ABC. Here's another: is lied to, being talked down to, inadequate. Now, depending on who you ask, different people might tell you inadequate is actually a feeling. I believe that inadequate is actually a belief. I believe that I am inadequate, and I feel maybe frustrated and depressed about that. So this is an important distinction to make. We need to know what to put in which column because we're going to write out our own ABC models to help us identify our unhelpful thinking so that we know what to change moving forward. So here's some examples that we can walk through. The first example is you arrive at home from working all day to find your partner relaxing on the couch. Then you see the sink is full of dishes. What might be the activating event in this situation? So when we're identifying the activating event, that is, what are the facts of the situation that upset me here? What are the facts? So facts are I arrived home, I was working all the day, my partner was on the couch, the sink was full of dishes. Those would go in the A column when we're writing out our activating our ABC. What are the beliefs that are triggered by the activating event? What could you think in this situation? Maybe you think, how dare you, sitting there on the couch relaxing while I'm working all day. You don't care if I have to come home and do all these dishes. You don't care about me. You could think that. You could think, oh God, now I have to do all these dishes before I do dinner. This person doesn't respect me. This isn't fair. And if you have thoughts like this, what are the consequences, the emotions and behaviors that you have in this situation? How do you feel when you think these things? Well, you probably feel angry, frustrated, and disappointed, maybe sad. And how do you behave? Well, maybe you are a really great communicator and you use effective communication skills using I statements to communicate how you're feeling to your partner. Or maybe you behave aggressively, you intimidate them, you yell at them. Maybe you behave passive aggressively, you do the dishes, but you're slamming cupboards or using the silent treatment. So in this way, those would be consequences. Those would go in the C column. For example, you're sitting in your room and you've been on the computer for 6 hours. You've not left home in several days. You drank 5 beers so far this evening. You open your 6th beer and think, life sucks. I should be out doing things, but I can't because I am depressed. What do you think is the activating event in this situation? Well, there's probably a number of things that could be activating events, but you could say, I've stayed home for several days. I was on the computer for 6 hours. I had 5 beer. All these could be activating events, depending on what you find upsetting about the situation. But again, remember, when we're writing out an activating event, in our A column, we're just going to stick to the facts. So we wouldn't write something like, I was being lazy or I was feeling down. Those would maybe belong in a different column. What do you think your beliefs or thoughts might be in this situation here? Well, we know there's one belief right there, that life sucks and that you should be out doing things, but you can't because you're depressed. So there's a belief that I can't do things when I'm depressed, right? There might be other beliefs like I am a failure, I am a loser, other people should be helping me, nobody cares about me, life is pointless, those kind of beliefs. Those would go in the B column. What are the consequences? How do you think you feel in this situation? Maybe you feel depressed, maybe you feel sad, maybe you feel bored. And what do? Well, you might just keep doing what you're doing. You might have that 6th beer and start a 7th. Stay on the computer. Alright, one last example here. You've been on medical leaves for 8 months now. You're grocery shopping and you see a coworker and they approach your cart. You feel terrified. So in the A column, we would write, saw a coworker in grocery store. You could write that. You could write, you could be more detailed. I've been off work for 8 months. Saw a coworker in grocery store. They were approaching my cart. Again, A is the least important part of the ABC model, but try to stay factual. What are your beliefs? What do you think in this situation? You might think something like, they're going to think I'm faking it, right? You could think they're going to ask why I've been off. They're going to assume that I'm faking the illness. They might pressure you to return to work. They might be mad at me. They might go back and tell my boss that they saw me. They're going to think, if I can grocery shop, why can't I work? All kinds of stuff. So those could be the beliefs. How would you feel? Well, you might feel terrified. You might have that anxiety, that fight, flight, freeze response. You might be terrified of returning to the store in the future. That could be the outcome of the situation. You might just leave your cart, run from the store. You might ignore them, pretend they don't exist. So, by breaking this down, you're able to look at, identify each aspects of your experience, both your facts, your beliefs, your feelings, and your behaviors. So, when we're using the ABC model, I encourage you to practice this at home. Take a blank piece of paper, and at the top you can write A, B, and C. Maybe even put a couple lines. Give yourself a larger area for the B column, because tend to be more in the B column. You would write out your activating event. Maybe you went to a CBT group. Maybe you went grocery shopping. Maybe you called your mom. Whatever it is. Just really briefly describe the facts of the situation. Then I encourage you to go to C over here on the side, because for me at least, my feelings, I'm more aware of my feelings than I am my thinking, and I can use my feelings to identify my thinking sort of retrospectively. So anyways, I encourage you to go A to C. So you go to a CBT group, maybe you feel anxious, terrified, depressed, and panicked. Okay? And maybe you avoided going, or maybe you're going to avoid going in the future. That would be a behavior. Some beliefs you might have about this situation are, they're gonna make me talk. I could say something stupid. People might judge me. They're gonna go home and tell everybody about how stupid I am. And I won't be able to go anywhere without being ridiculed. It'll go viral or something. Everybody will know how stupid I am because that one thing I said in that CBT class. So this is helpful for us because when we identify that unhelpful thinking, we can think critically about it and use tools and techniques, CBT tools and techniques that we call cognitive restructuring tools, to change the way that we're thinking about the situation, so that when we go to an anxiety group in the future, we feel differently. So I'm going to conclude part one with a quote, and it's from Dr. David Burns' book, When Panic Attacks. One of the most common errors people make is trying to work out their problems in their head. As I've said, this won't work. You'll go around in circles because your negative thoughts and feelings will seem so overwhelming and convincing. Your task will be far easier if you record your negative thoughts and feelings on paper. Then you can focus on them one at a time. So I think this goes back to that slide from earlier where we talked about people want to get the most benefit from the smallest amount of effort. And so sometimes people try to use the ABC model in their head, particularly when they're trying to learn. And this can be really challenging, and I really encourage you to get some blank paper and to go through the ABC model, write ABC at the top, identify the facts, identify your feelings, and identify what you're thinking about that situation. This is called a thought diary. You're using the ABC to create a thought diary where you're paying attention to the kinds of thoughts you're having in upsetting situations. So I encourage you to practice every day. Take 5 minutes of your day, write down, what was one thing that upset you? What were you thinking about it? What were you feeling? How did you behave? This is cultivating your self-awareness, and the more self-awareness you have, the more choices you have. When you're aware of your patterns, you can choose to make different patterns. So this is the foundation that we're going to start on. And moving forwards, we're going to talk about, in the next part of this program, we're going to talk about how to use cognitive restructuring tools and techniques to change our thinking. In order to use those tools, we have to know what our thinking is. So I encourage you to practice, 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 writing down your unhelpful thoughts. And that's going to be helpful for moving forward. Thank you very much. I hope you enjoyed part one, and we're going to talk about using cognitive restructuring techniques to change our thinking in part 2. Have a good day.